All right, well, good morning, everyone. Thank you for coming out this morning. My name is Stephen Wallace. I am a professor of public health at the UCLA Fielding School of Public Health, chair of the Department of Community Health Sciences, and associate director at the UCLA Center for Health Policy Research, and I want to welcome you all this morning. The UCLA Center for Health Policy Research was founded in 1994 with the mission of improving the public's health through high-quality, objective, and evidence-based research and data that informs policymaking. And we're here today to launch Smokefree Apartments Los Angeles as a project through the UCLA Center for Health Policy Research. This is a citywide informational initiative focused on unwanted exposure to secondhand smoke among apartment tenants in Los Angeles. So, you may know smoking is the leading preventable cause of death in the United States. It's something we can do something about. And as a result, it's a major public health issue. Secondhand smoke is estimated to cause about 41,000 deaths every year in the United States. Secondhand smoke causes premature heart disease, causes strokes, cancers, and a whole set of health conditions. Our children, when they're exposed to secondhand smoke, cough and wheeze more often and have a harder time getting over their colds, and miss a lot more school days as a result as well. So it's an issue for children, it's an issue for older adults, it's an issue for families, it's an issue for all of us. In California, we suffer from a burden of smoking-related disease costs estimated at $10 billion a year in healthcare costs alone. So whether you're exposed to secondhand smoke or not, we're all paying for secondhand smoke. The aim of Smokefree Apartments LA initiative is to focus on privately owned, market rate, and affordable housing residents who, unlike many public housing residents in the area, are not protected against exposure to secondhand smoke. We see this as unequal protection. Unlike many nearby cities, such as Pasadena, Huntington Park, Compton, Santa Monica, and Baldwin Park, Los Angeles does not have any restrictions on secondhand smoking or smoking in private apartments. So this event is being held here at beautiful Fame Gardens apartment complex, which is a model because it is completely smoke-free. This is part of Fame Corporation's decision to make all of its apartment complexes citywide, smoke-free, effective last January, and we want to recognize their accomplishment in protecting the health of their residents. Smoke-Free Apartments LA initiative is funded by the U.S. Centers for Disease Control and Prevention through its Racial and Ethnic Approaches to Community Health Program, which is also known as REACH. The aim of REACH is to reduce racial and ethnic health disparities through community-wide efforts. So according to the U.S. Census Bureau, about 2/3 of Latinos and 2/3 of African Americans living in Los Angeles live in rented apartments. So in trying to reduce health disparities, focusing on rental apartments is a major priority. Overall, about half of all people in Los Angeles live in rental apartments, which makes Los Angeles one of the cities with the highest proportion of renters anywhere in the country. Yet most apartments in Los Angeles City have no smoke-free policy. And tenants who want to live in a smoke-free environment are unable to do so because of the shortage of low-income housing, which limits their options to try to avoid smoke-filled environments. Some of our most vulnerable populations live in apartments. Smoke-Free Apartments Los Angeles aims to reduce chronic disease through increased access to smoke-free housing, as well as by increasing the availability of smoking cessation services provided by area clinics and linking people with resources to quit smoking. So you may or may not know this is National Public Health Week this week all over the country. And so we thought it was a fitting time to launch our Smoke-Free Apartments LA initiative because smoke-free housing is such a vital public health issue. It fits into the national public health initiatives. And we're proud of the fact that a broad range of community organizations have come together as part of this initiative to give both tenants and apartment owners the information they need on the benefits of smoke-free apartments and knowledge about how to make this happen. Some of our partners that have been key in this collaboration include Smoke-Free Air for Everyone, the Apartment Association of Greater Los Angeles, CD Tech, Fame Corporations, LA County Department of Public Health, American Lung Association, American Heart Association, American Cancer Society, and for all of those of you who I haven't mentioned, I want to thank you as well. So today, in this press conference, we're presenting some findings, which I think you'll find very interesting, from surveys of tenants and landlords who are talking about their knowledge and experiences of secondhand smoke and their level of support for smoke-free apartment living. So as a little tease, I'll let you know that the surveys show strong support for smoke-free apartment living from both landlords and tenants. It's a broadly supported idea. But they also report that they need more information and support to create the smoke-free housing that most people want. After we report on the findings from our survey, we'll also introduce our advertising campaign that is designed to help link people to the resources they need to increase the availability and use of smoke-free housing. So at the heart of our efforts is the protection of our families, our children, our older adults, and others who are suffering through exposure to secondhand smoke. One such person is Carolina Lopez, a Los Angeles apartment tenant who suffers from secondhand smoke exposure and cannot afford to live. So she'll give you the face of somebody who's experiencing the problems of secondhand smoke. She's going to share her views on why our efforts are important to her and other apartment residents in the city, and then we'll move on to our data and our campaign. So, Carolina?